Continuing our definition of psyche, or words that begin or with psycho or psyche or psych, the Greek word for mind, psyche, psyche would be the word for soul. And we're starting now with psycholepsy. Lepsis is the word for seizure, sudden alteration of moods in which mental inertia and hopelessness are manifested. There's also a synonym, paralepsy. Psycholeptic, concerning sudden shifting of moods, particularly to one marked by hopelessness and mental inertia. Psycholinguistics, a study of linguistic or linguistics as it relates to human behavior. Psychological, pertaining to the study of the mind and all of its relationships, normal and abnormal. Psychologist, one who is trained in methods of psychological analysis, therapy, and research. Psychology, the science of dealing with mental processes, the study of mental processes, both normal and abnormal, and of course their effects upon behavior. There are two main approaches to the study: introspective, looking inward or self-examination of one's own mental processes, and objective, which is studying the minds of others. And so we have abnormal psychology, the study of deviational behavior and the mental phenomena associated with such. Then we have analytic psychology, psychoanalysis based on the concepts first penned by Carl Jung, de-emphasizing sexual factors in motivation. That was Freud, and of course he emphasized what he called the collective unconscious and things such as psychological types, such as introvert and extrovert. Then we have animal psychology, which is the study of animal behavior. Applied psychology, which is the application of the principles of psychology to special fields such as clinical, industrial, educational, nursing, psychology. For example, you could have applied would apply to other fields such as clinical psychology, industrial, organizational psychology, educational psychology. And then clinical psychology, which is the branch of psychology concerned with diagnosing and treating mental disorders. Criminal psychology would be the branch of psychology that is concerned with the behavior and therapy of criminals. Dynamic psychology would be the psychology of motivation, or that which seeks the causes of mental phenomena. Experimental psychology is the study of mental acts by tests and experiments. Genetic psychology would be the branch of psychology concerned with the evolution and the inheritance of psychological characteristics. We also would probably put evolutionary psychology in there, and as well as cognitive psychology. Then we have Gestalt psychology, which it emphasizes the wholeness of psychological processes and behavior, maintaining that such cannot be adequately explained by breaking down into constituent parts. Then we have individual psychology, which is a system of psychological thinking developed by Alfred Adler, in which an individual is regarded as having three life goals: that of physical security, that of sexual satisfaction, and social integration. Self-evaluations lead to feelings of inferiority and inadequacy, which often lead to overcompensation or a striving for superiority. And so, in individual psychology, we're seeing the individual as having three life goals: physical security, sexual satisfaction, and social integration. Then we have physiologic psychology, which deals with the structure and function of the nervous system. Again, and of course, in the history of modern psychology, you have structuralism and functionalism. But psychology, physiologic psychology, deals with the structure and function of the nervous system, or the CNS, and other bodily organs, and their relationship to human behavior. Social psychology, which is the branch of psychology concerned with the study of groups and their influence on the individual's actions and mental processes. Then we have psychometrician, Again, it is a person skilled in psychometry, a person skilled in the application of statistical analysis to psychological data. Psychometry is the measurement of psychological variables such as intelligence, aptitude, behavior, and emotional reactions. Psychomotor, again, as we've discussed in a previous reading, motor is Latin for mover, concerning or causing physical activity associated with mental processes. Psychomotor and physiological development of infant. We went over that, and it is important to note that it is that all concerned with the care of the newborn through infancy have guidelines for comparing the growth and development of an individual with normal standards. Certain activities of infants serve as general indicators of normal psychomotor development. The average ages for certain of these activities have been recently discussed. Appearance and loss of certain reflexes and reactions. The Moro reflex is present at birth and disappears by 3 months. The stepping and placing reflexes are present at birth and are no longer obtainable by 6 weeks. The tonic neck reflex is usually present at 2 months and is gone by 6. Neck rightening appears at 4 to 6 months and is gone by 24. The parachute reaction is present at 9 and persists. Sucking and rooting are present at birth and are usually gone by 4 months if tested while awake, and by 7 months if tested while the infant is asleep. Palmar grasp is present from birth to 6 months. Plantar grasp is present from birth to 10 months. Psychomotor epilepsy. Epilepsy, temporal lobe. Psychomotor retardation. A generalized slowing of physical and mental reactions, seen frequently in depression. Psychoneurosis, from neuron, which means sinew, or osis, meaning condition. Emotional maladaptation due to unresolved unconscious conflicts. This leads to disturbances in thought, feelings, attitudes, and behavior. There is little, if any, loss of contact with reality, but the patient's effectiveness in performing his or her usual responsibilities and tasks is handicapped. Psychoneurosis is a major category in classifying mental illness, and it is classified in according to the symptoms that predominate. The patient usually recognizes that the altered thoughts and feelings are abnormal and indeed unwelcome, and this is in contrast to the patient with a psychosis or character disorder. It says character disorder, but we really should be talking about personality disorders. Of course, a synonym would be neurosis. We have, in terms of psychoneurosis, we have anxiety reaction, anxiety with apprehension out of proportion to any obvious external cause, and conversion reaction, which is psychoneurosis in which unacceptable unconscious impulses are converted into hysterical somatic symptoms. Although the symptoms have a specific symbolic meaning to the patient, their interpretation is different in each individual. Concerning depressive reaction, psychoneurosis marked by depression out of proportion to any obvious cause. Dissociated reaction. Psychoneurosis characterized by dissociated behavior, such as amnesia, sleepwalking, and dream states. It is important to differentiate this from schizophrenia. Obsessive-compulsive reaction. Persistent, repetitive impulses to perform certain acts or certain rituals, such as hand-washing, touching something, or counting. And of course, then we have phobic reaction, irrational fear of a variety of situations, persons, or objects. And then we have psychoneurotic, pertaining to a functional disorder of mental origin, a person suffering from a psychoneurosis. Psychoparesis, weakness or enfeeblement of the mind. Psychopath, from pathos, meaning disease or suffering. Individual with a psychopathic personality. And of course, you might want to see the definition of personality and psychopathic to understand the psychopath. Psychopathia, or psychopathia, is simply psychopathy. Psychopathic, concerning or characterized by a mental disorder, concerning treatment of mental disorders, and abnormal. Psychopathology, from the Greek word pathos, disease or suffering, and the logos word or reason, the study of the causes and nature of mental disease or abnormal behavior. Psychopathy, any mental disease or disorder, especially one associated with defective character or personality. And we also want to look at personality and personality disorders as well as psychopathic. Psychopharmacology is the science of drugs having an effect on psychomotor behavior and emotional states. Psychophysical, from physikos, the Greek word for natura or natural, concerning the relationship of the physical and the mental. Psychophysics is the study of mental processes in relationship to physical processes, the study of stimuli in relationship to the effects that they produce. Psychophysiologic, pertaining to psychophysiology. Psychophysiologic disorders. It is the term applied to a large number of disorders of origins and viscera innervated by the autonomic nervous system, the ANS, in which emotional factors are a primary contributing factor, formerly called psychosomatic disease or disorder. Psychophysiology. Physiology of the mind, science of the correlation of body and mind. Psychopelagic, an agent reducing excitability of the mental processes. Psychoprophylactic preparation for childbirth is mental and physical training of the mother in preparation for delivery of the child. The goals of the preparation are the dispelling of the fear of pain and the delivery of a healthy child. And that's the Lemay's technique or method to prepare females for childbirth. Psychoprophylaxis in obstetrics, a method of mental and physical preparation for natural childbirth. And again, see Lemay's technique or method. Psychorhythmia, from the Greek word rhythmos, for rhythm, a mental condition in which involuntary repetition of previous voluntary action occurs. Psychoria, from rhea, which means flow, is mental condition characterized by an incoherent stream of thought resulting in vague and often bizarre theories and ideas. Psychosensory, the Latin sensorius, organ of sensation. It is understanding and interpreting sensory stimuli concerning perceptions not arising in sensory organs as hallucinations. Psychosexual, from the Latin word sexus, for sex, concerning the emotional components of sexual instinct. Psychosexual development is the evolution of personality through infantile and pregenital periods to sexual maturity. Psychosexual disorders are disorders of sexual function not due to organic causes. Included are gender identity disorders, transsexualism, paraphilias, transvestism, zoophilia, pedophilia, exhibitionism, and sexual sadism. Psychosin is a cerebrocid present in the brain tissue. Psychosis, from osis, meaning condition, and psychosis, plural, is a term formerly applied to any mental disorder, but of course now generally restricted to those disturbances of such magnitude that there is personality disintegration and loss of contact with reality. Of course, the disturbances are of psychogenetic origin or without clearly defined physical cause or structural change in the brain. They usually are characterized by delusions and hallucination, and hospitalization generally is required for psychosis, but not necessarily. And of course, this condition is manifest in the behavior, emotional reaction, and ideation of the patient, who fails to mirror reality as it actually is, who reacts erroneously to it and builds up false concepts regarding it. Behavior responses are peculiar, abnormal, inefficient, or definitively antisocial. These behaviors are peculiar, And of course, this does not include amentia, because defective intelligence merely lessens comprehension of reality or understanding of reality, but does not distort it. The psychopathic personality reacts badly because of intrinsic emotional differences, playing upon an undistorted world of reality. We have different types of psychosis. Alcoholic psychosis resulting from chronic alcoholism, Korsakoff syndrome, and delirium tremens. Depressive psychosis, characterized by extreme depression, melancholia, and feelings of unworthiness. Drug psychosis, caused by ingestion of a drug. Exhaustion psychosis, acute state of confusion and delirium that occurs in relation to extreme fatigue, chronic illness, and prolonged sleeplessness or tension. Functional psychosis, which is psychosis that is not due to an organic disease. Gestational psychosis, which occurs during pregnancy. Involutional psychosis, occurring during involutional period of bodily and intellectual decline. This tends to happen in women from ages 40 to 55 and in men from age 50 to 65. Then we have Korsakoff's syndrome, and of course, manic depressive psychosis, ordinarily a series of periods of psychotic depression or excessive well-being, appearing in any sequence and alternating with longer periods of relative normalcy. Though the intensity may vary greatly from days to weeks to months, and of course, the manic shows an elated, though unstable mood, a flight of ideas, and a great physical activity. In primary depression, the victim finds all exertion exhausting. There is difficulty in thinking or acting, and the victim is very unhappy. Synonym would be the bipolar affective disorder. And of course, organic psychosis, the psychosis resulting from a pathological condition of the central nervous system, CNS, such as paresis. Polyneuritic, which is also Korsakoff syndrome. Post-infectious psychosis follows an infectious disease such as meningitis, pneumonia, or typhoid fever. Postpartum psychosis is psychosis occurring in the period following childbirth. See postpartum psychosis. Puerperal psychosis is postpartum. Senile psychosis is due to old age. Situational psychosis is psychosis due to excessive stress in an unbearable environmental situation. Toxic psychosis results from toxic agents. Traumatic psychosis results from head injuries, and it belongs to the organic group. Psychosocial is related to both psychological and social factors. Psychosomatic is, and soma is the Greek word for body. It pertains to the relationship of the mind and body, of course, the brain and the rest of the organs, as well as the other parts of the body. Psychosomatic are disorders that have a physiological component but are thought to originate in the emotional state of the patient, are termed psychosomatic. And when so used, the impression is created that the mind and body are separate entities, and that of a disease may be purely somatic in its effect or entirely emotional. Of course, this comes from older Cartesian dualism, and this partitioning of the human being is not possible. Thus, no disease is limited to only the mind or the body, and so a complex interaction is always present, even though in specific instances a disease might be on superficial examination, and it might appear to involve only the body or the mind. And so we want to see psychophysiologic disorders. Psychosomatic medicine is the branch of medicine that recognizes the pertinence of mind-body interrelationships in all illnesses, and in which therapy and management are based on this fact. Psychosurgery, from the Latin chirurgia, for surgery, is surgical intervention for mental disorders, especially for certain types of violent or antisocial behavior. Then there is psychotechnics, from the word techne, meaning art, which is use of psychological methods in the study of economic and social problems. And so that would probably be within the realm of social psychology. Psychotherapeutic drugs, again, are drugs that are used because of their effects in ameliorating or remedying the principal symptoms that occur in mentally disturbed persons, such as anxiety, depression, and psychosis. Psychotherapy, again, from therapia, the Greek word for treatment, is a method of treating disease, especially nervous disorders, by mental means rather than physical means. Of course, an example would be suggestion, re-education, hypnotism, or psychoanalytic therapy. And so we might think of other things like cognitive behavioral therapy and things of that nature. Psychotic is pertaining to or affected by psychosis. Psychotogenic is producing a psychosis, usually temporary and due to certain powerful drugs. Psychotomimetic, from mimetikos, for imitative, is a hallucinogen producing weird illusions and phantasms. Psychotropic drugs, remember we talked about psychotropic drugs that affect psychic function, behavior, or experience. And of course, many drugs can be classed as being intentionally psychotropic, but many other drugs also occasionally may produce undesired psychotropic side effects. Of course, psychralgia or psychralgia, for psychros, meaning cold, and algos, meaning pain, is painful sensation of cold. Psychoesthesia is from the aesthesis word for sensation, is a sensation of cold in a part of the body, although it is warm. Psychrometer is the device for measuring relative humidity of the atmosphere. Of course, calculations are made utilizing the readings of two thermometers, one with a dry bulb and one with a wet bulb. Psychophilic, from feline, meaning to love, is preferring cold, as bacteria that thrive at low temperatures between 0 degrees and 30 degrees Celsius, which is an equivalent conversion to 32 degrees and 86 degrees Fahrenheit. Psychrophobia, from the Greek word phobos, for fear, is an abnormal aversion or sensitiveness to cold. And psychophore, some forerine, to carry a double lumen catheter for applying cold to the urethra or any canal. And of course, we end with psychotherapy. Psychotherapy, not to be confused with psychotherapy, but psychotherapy, from the word therapia, meaning treatment, is the treatment of disease by use of cold. And there you have it. We're done with all the words in Tabor's Cyclopedic Medical Dictionary. And of course, this one's just the 16th edition from 1989. I'm sure they've come up with other dictionaries and other editions since then. But at least these were all the words that begin with psycho and psych.